HOSA, I have had the privilege to travel to many exciting places and meet hundreds of wonderful people. But tonight is one of the most exciting experiences ever, as I have the honor to introduce the United States Surgeon General to HOSA-Future Health Professionals. Vice Admiral Jerome Adams, better known as the nation's doctor, is the leading spokesperson for national health matters and policies in order to advance the nation's health. Vice Admiral Adams earned his medical degree from the University of Indiana School of Medicine. A board-certified anesthesiologist, he has made opioid addiction and mental illness his priorities during his tenure as Surgeon General. Importantly, he abides by this motto: better health through better partnerships. He is committed to strengthening relationships with all members of the health community and forging new partnerships for better public health. HOSA members, it is my immense honor to welcome Vice Admiral Jerome Adams.
All right, what is up, HOSA? I know it's Friday, I know it's been a long week. What is up, HOSA? Are you all ready to elevate your minds? I hope so. Thank you so much for the kind introduction and for the warm welcome. My name is Jerome Adams, and I am your 20th United States Surgeon General. Now, I know some of you in the audience may be unfamiliar with what the Surgeon General actually does, so it may help if I debunk just a few myths out there. First of all, I am not the Attorney General. So for any of you aspiring lawyers out there, I apologize. I'm not that guy. I don't want the questions he's having to take right now. And I'm sure he'd much rather be here talking to you all than getting grilled on Capitol Hill. Second, even though I'm the Surgeon General, I'm neither a surgeon nor a general. I'm actually an anesthesiologist, and I'm a Vice Admiral. And as a Vice Admiral, I oversee the operations of the United States Public Health Service Commission Corps, an elite team of over 6,500 highly qualified health professionals who are committed to protecting, promoting, and advancing the health and safety of the nation and the planet. And we've got some Commission Corps officers here today. If you're here and you're in the Commission Corps, can you please stand up? Our officers are doctors, nurses, dentists, pharmacists, vets, engineers, environmental health officers, therapists, and many more. We respond to disasters like wildfires, like hurricanes, like Ebola and measles outbreaks. And we also provide essential healthcare services to underserved and vulnerable populations, like those who live on reservations, those who are in Bureau of Prisons, those who, again, have trouble accessing the care that they need, those who many of you all, as future health professionals, have committed to serve. And that's why we want all of you to consider the public health service as a potential career path. I was talking to some students earlier, and I actually said, you know, interestingly enough, HOSA is like the junior version of the public health service. So I expect all of you all, there got to be at least a couple future Surgeons General in the crowd out there today. And I hope many more future members of the public health service. But you know, the most visible role of the Surgeon General is to communicate the science around health to the American people. And as the nation's doctor, I'm focused on promoting health, preventing disease, and leading with the science to help all Americans live the healthiest lives that they can. Now, I want to tell you a little bit more about me personally. We didn't have HOSA in my town when I was growing up, but I was involved with my school's math and science clubs. I always knew that I wanted to help people, but a career as a physician never crossed my mind. And how many of you all got to hear me last year? Quite a few out there. We talked a lot about diversity last year, and you see, in the rural town where I grew up as a poor minority youth, I never met another black doctor. The fact is, I never knew there was a such thing as a black doctor. My parents were both teachers and both stressed the value of an education, but I had a limited view of what I could do with my education. And it's why all of you being here today is so very important, and why I am so honored to have the opportunity to address you for just a little bit. Now, I also spent a lot of time in hospitals as a child due to my asthma. I would go to the emergency room to be treated by a physician and then sent back home. But no matter what they did, guess what? I always ended up right back in the emergency room over and over and over again. You see, the medicines they gave me in the hospital, they made me feel better in the moment, but they didn't change the fact that I was constantly exposed to allergens, asthma triggers like mold, like pet dander, like smoke in my home environment. The fact is, health, and I want you all to hear me say this as future health professionals, health is so much more than hospitals or medicines or doctors and nurses. There are numerous studies out there that tell us that access to health care only makes up 20% of our overall health. There are other determinants of health that play a far bigger role, quite frankly, in whether or not you're healthy than anything that you would get in a typical healthcare encounter. Now, judging by the fact that you're here today at HOSA, I think it's fair to say that people in this room know more than the average student your age about health. And at the very least, you want to be healthy and to promote health throughout all of your communities. So how do we accomplish this? Well, I'm going to tell you something that may sound shocking to hear from the Surgeon General, but the truth is the science hasn't changed much around health promotion in the last 20 years. And the amount of time, longer than the amount of time most of you have been alive. You already know how to stay healthy, how to be healthy. Let me show you. We're going to do a quiz. What's healthier, broccoli or French fries? See, you guys know. Is it better to play video games or to go outside and be physically active playing sports? And anyone out there not know that cigarettes are bad for you? Or that something called an e-cigarette is really bad for young people? And if you don't know that e-cigarettes are bad for you, I challenge you to check out my advisory at surgeongeneral.gov, because I put out an advisory geared specifically towards all of you and your colleagues, helping folks understand there was a 78% increase in high school seniors using e-cigarettes last year. Tobacco use has been going down for the last decade among young people. It's now starting to go back up because of e-cigarettes. And I'm really worried about a future generation of young people becoming addicted to nicotine. But back to my overall point, we know what the science says that we have to do to be healthy, but all of us are guilty, all of us, of making choices that aren't always in the best interest of our health. You might sleep an extra hour tomorrow morning because it's been a long week, instead of going for a run with me and Mickey. Who's going to run with me tomorrow morning? You might choose chocolate cake because Disney's got some really good chocolate cake instead of a fruit cup for dessert. And that's okay. That is okay because no one is perfect. The key is that you make more good choices than unhealthy ones over the long haul. It's all on you, right? But that's a very simplistic and, dare I say it, a very naive way of looking at how and why these choices are made. For some people, you might want to go play pickup soccer with a neighbor, but if there are no local green spaces in your community, or the park is where all the drug dealers hang out, You don't have that option. And how many times after a long day of school do you go to a vending machine and grab a bag of potato chips or a soda because it's the cheapest, the easiest, the most available option? You know, I believe we all have a responsibility to make good choices, but I also firmly believe that people's choices are 100% defined by the choices, the options that are laid out in front of them. We might know what the healthy thing to do is, and all of you knew what the healthy things to do were when I asked you the questions, but if it isn't convenient, affordable, or available, then it's not really a choice, is it? So what I'm talking about, the access, the ability, the aptitude to make decisions in the best interest of our health and well-being, it's what we call the social determinants of health. The social determinants of health are non-medical or traditional factors that directly impact the health and well-being of an individual. These factors include greater environments, community and social support systems, and intersecting oppressions. Things like reliable transportation. And do we have my slide of the social determinants? Here we go. Things like reliable transportation, safe, affordable housing, access to fresh fruits and vegetables, and non-stigmatizing, racism, gender bias, and judgment-free communities. Did you know that access to a safe and nurturing environment, good nutrition, and pediatric care as a child can measurably lower symptoms of depression, prevent marijuana use, and correlates with a more active lifestyle by the age of 21? That's not about choices, that's about environment. Or that by implementing cradle-to-grave educational and recreational opportunities while addressing housing insufficiency needs can lead to significantly lower rates of violent crime and associated mental illness. And I know some of you in this audience are wondering, why is the Surgeon General talking to us about things that seem to be beyond our control, or at least beyond the purview of a healthcare professional? Some of you may be even a little upset that the nation's doc is seeming to downplay the importance of clinical care, because I know we've got many future doctors, nurses, physician assistants, clinicians in the crowd. Well, if you're feeling frustrated or angered by the injustice or helpless, that's good, because I want you to harness that emotion, and I want you to funnel it into everything that you do in your lives moving forward. It is the role of every healthcare professional to learn about and ask about and seek to address all the factors that far too often make the unhealthy choice the easy or the only choice for patients and communities. I can't tell you, and I'm embarrassed to say this, but it's the truth. I can't tell you how many times I've taken care of someone who's been shot, someone who's used drugs, and I patched them up, but I never stopped to ask them about their neighborhood, to ask them if they had a place to go back home to. And we send them back out into these environments, and they come back over and over and over again, and we blame it on bad choices, but the fact is, they didn't have a choice. We sent them back to the same gang-ridden environments. We sent them back to the same circumstances that led them to us in the first place. And what's the definition of insanity? It's doing the same thing and expecting a different result. I told you I had bad asthma growing up. Imagine if just once a healthcare provider had asked about my home environment, had done a home assessment, or advocated for greater availability of smoke-free housing. It's very likely it would have done more for my asthma than all the medicines, all the doctors, all the hospitals in the world. And as far as being the U.S. Surgeon General, my story, because a lot of people want to know how I got here. My story could have easily turned out very differently. Some of you know this, but my own little brother, Philip, sits in a prison cell right now. He's serving a 10-year sentence for stealing $200 to support his drug addiction. And I mentioned the impact of judgment and stigma and discrimination on health. You know, we're not going to talk today about the fact that far too many people of color are handed heavy sentences for what society deems a moral failure, while non-minorities get off with a slap on the wrist or multiple chances at rehabilitation. I love you guys. You just made my heart about jump out of my chest with that applause because, I tell that story in different crowds, and some folks just don't get it. They don't get it. You guys get it, HOSA. But we're not going to get into that because we talked about diversity last year, and again, that would just take too long. But I do want to highlight the importance of community interventions to support resilience. My brother and I, we didn't have rich parents. We didn't go on nice vacations. We weren't able to go to summer camps. But I personally, especially compared to my brother, was very lucky. In addition to my parents, I was guided by mentors throughout middle and high school and into college who gave me encouragement and purpose and guidance. I had school programs like your HOSA program that kept me away from bad influences and surrounded me with good, like-minded people, like the people who are all around you right now. The opportunities I was given and the environment I was in, it gave me my platform to change my future and ultimately become your Surgeon General. And that's despite not thinking I could ever have been a doctor when I was sitting in the same seats that you are right now and when I was your age. But my brother, like too many others, hasn't been so lucky. You see, your networks are one of the social determinants of health. If your networks are bad people, people who can't lift you up, they're going to bring you down. If they're good people, people like the people around you, they're going to lift you up. And instead of being lifted up by mentors, people like my brother are pulled down far too often. Instead of being offered community supports, they're marked as problem children who make bad decisions. And addressing this issue, it's not just a moral imperative, but also a financial one. It costs $150 to $200 a day to incarcerate my brother. That means taxpayers, all of you all in this audience, are going to spend nearly $500,000 keeping my brother locked up without doing a thing to address the problems that put him in prison in the first place. Imagine all the savings and different future that could be possible had $5,000 been spent on a drug court diversion program, had $500 been spent on mental health treatment to address his anxiety and depression, had $50 been spent on a community center program so that, again, he had those positive supports around him, versus $500,000 to lock him up. My brother and I are living examples of the very different outcomes when you consider and address these social determinants of health and make the healthy choice the easy choice. Now, I'm going to close, but I want you all to understand that by virtue of you being here today, you've demonstrated yourselves to be America's future leaders of healthcare and of its health. You have the ability, HOSA, to shape what that looks like and advocate for upstream preventive interventions versus a singular focus on downstream sick care, versus waiting for people to get sick and hurt and then trying to fix them instead of preventing them from getting sick and hurt in the first place. HOSA, you are the future. You guys are the future. You know, I don't even like saying that because you're the now. I was talking, give yourselves a round of applause. This isn't in my speech, but I was talking to a group just before I came in, and I was telling them I've been going to Congress and to my state legislature for over 20 years. And the thing I've noticed is the older I get, the less they listen to me. I started going when I was your age. And when I see a young person come into my office now, a Surgeon General, I know they're there because they're passionate about what they believe in. When an adult comes in my office, the first thing that pops in my head is, what do they want? Where are they trying to get me to spend more money? And so I want you all to understand, I tell you that because you're not just the future, you're the now, and you have more of a voice than you might think. You just have to be brave enough to use it. So I implore you to learn. Learn about your community members, classmates, and friends who may be disproportionately affected by their social determinants of health. Hear their lived experiences and share them and lift up their voices and their concerns because far too often they aren't heard. Then I urge you, once you've learned, to engage. Advocate for policies in your school that put the health and well-being of all students first. Call, or better yet, go visit your local legislators and help her or him understand why limiting the marketing and availability of e-cigarettes in communities or raising awareness about the dangers of youth opioid and marijuana misuse in some communities can lead to healthier individuals making healthier decisions. And the final thing that I implore you to do is to persevere. You know, life can feel unfair, and that's because sometimes it is. Just ask my brother. But as the youth of our nation, it lies in your hands to determine what our future and what your future looks like. And to do that, we have to ensure that all people have a fair opportunity to be their best selves. HOSA, it's up to you to be the first generation of health leaders that looks to address not just the 20% of health that is healthcare, but to address the full 100% of what makes our communities healthy, and especially considering the social determinants of health. Learn, engage, and persevere, and our nation will be a much better, a much healthier, a much happier, and more loving place if you do. Thank you so much, HOSA, and don't forget to follow me on Twitter, Jerome Adams, MD, or surgeongeneral.gov, on Instagram, on Facebook, and go to surgeongeneral.gov for more info on what I'm working on, and tweet hashtag no e-cigs for kids, tweet hashtag vaccines save lives. You all just made me really happy with that. I'm gonna say it one more time, hashtag vaccines save lives. And hashtag no cannabis for kids. All right, so I'm excited now. We're gonna do a selfie video. All right, you guys ready? Hold on, calm down. Wait. I'll tell you when. All right, America, I'm here at the annual HOSA-Future Health Leaders Conference, and everyone in this audience wants you to know that hashtag vaccines save lives, right guys? That's going right on Twitter. Thank you guys so much. I'm out.
Sun is down, freezing cold.